So we're going to talk about stress today. Stress actually is just like an overwhelming issue with so many of our patients, and they come to us for physical help, for help on their physical stuff. What I've found is until or unless the fact that some of these patients are totally stressed out, until or unless that is addressed, it just puts a damper on anything that anybody tries to do to help themselves or for us to help them. So I'm going to talk today about different types of stress, where stress comes from, and we're going to touch on sympathetic, parasympathetic balance and adrenal function, cortisol, the effect on sex hormones. We can talk a little bit about the effects on thyroid, and then how stress impacts the neurologic system and the immune system. So when we think about stress, a lot of people will think just about emotional stress, which is a major form of stress. But there are all kinds of stressors, and there are good stressors that also can act as major stressors. But different kinds of stress, we have to think about physical stressors, things like surgery, athletic injuries, car accidents, all kinds of things. Chemical stress is a huge thing in our world as well, being that there are about 85,000 chemicals that have been introduced since World War II. And we are just swimming in a sea of chemicals, and our bodies are really trying to figure out what to do with them. And then there are the chemicals that we're choosing to put into our bodies, and blah, blah, blah. So there are tons of chemicals that are stressing out our bodies in various ways. And we've talked a lot about those, but also just to know that that is a form of stress. And that is a place where the immune system actually puts stress on other systems of the body, on the nervous system and the adrenals. And then emotional stress. And emotional stress is what we all think of when we think of stress. Stress is another pandemic. And we are living in a 24/7 world. Our phones don't shut off. The outside world doesn't shut off. And unless we become really good at shutting things off ourselves, we are constantly bombarded, and we need to, anyway, this stress, all of these stressors just play a big role and affect our bodies. We're going to talk about how that happens. And also good stress. Three of us just went to A4M and came back from A4M. And my son will tell you this morning, I was stressed because I was tired and I had a lot to do. And so we have these stressors. A4M was a really great stress. And weddings are good stress, parties are good stress, but they are all stressors, and we have to look at them as being stressors. And sometimes I'll even, when I'm going through kind of the timelines with my patients, sometimes I'll even see, oh, it was the wedding or oh, it was the cruise or something like that, that ended up being the trigger. That was the moment at which their health changed. So we do have to think about that. So we all know the HPA axis. This is the hypothalamic pituitary adrenal axis. So starts in the brain. The hypothalamus responds to a stressor, and then it puts out corticotropin releasing hormone, which then affects the pituitary and makes the pituitary release adrenal corticotropic hormone, ACTH, and then that affects the adrenals, signals the adrenal glands to then make cortisol. What does cortisol do? So cortisol basically is our 24/7 stress hormone. We have our fight or flight system, which I'm not going to talk about today, which is our epinephrine, norepinephrine. And then we have our chronic stress system, which is just a lower grade, longer term kind of a stress system, which is affected by the adrenals and also by our autonomic nervous system. So cortisol helps us to deal with our day-to-day stress. A lot of people call it the 24/7 stress hormone or the 21st century stress hormone. And basically, it just gets our bodies ready to handle stress. It basically raises our blood pressure a little bit, increases our heart rate, increases our blood sugar and fatty acids so that we have more circulating fuel for whatever it is that we need to stand up for. And our heart rate, our breathing gets a little bit quicker. We get more blood to our muscles and also to our brain. And blood gets shunted away from digestion and away from the immune system. We also know that, of course, our pupils dilate and all of our senses become a little bit enhanced when we have more cortisol circulating. In general, it's a great little system, because when our bodies are not feeling it, let's say I woke up today and I was tired, but I pulled through the day. That was in part my cortisol. I've learned to self-regulate, of course. We all have to some extent. So I was trying not to make it my cortisol, but I'm sure my cortisol helped me. But we all know that when we're working that extra day, we're standing 14 hours, we didn't get a chance to eat, we didn't get a chance to go to the bathroom, whatever it is, that these are the times when we call on our adrenal glands and we call on our cortisol. And many of us do it many times a day. And what we're learning, we've learned so much, but what we are learning is just how it's not a good idea to be calling on that cortisol all the time. So what chronic cortisol elevation affects is the blood sugar and insulin system, because by increasing blood sugar, it's also increasing resistance. It affects our lipid levels. It affects our end organs, our heart, our blood vessels, our liver. There is a significant effect on the gut-brain connection. There's more and more study on, if you guys haven't connected with the PLMI conference that happened a couple of months ago, every one of those talks are free and available. So and there's so much talk about the connection between the nervous system, the gut, the brain, the immune system. We'll talk a little bit about some of those connections, but anyway, there's so much detail now, and it's just so interesting how all of these different things are connected and how our neurotransmitters are connected to affect our immune system, affect our gut, and vice versa. It's just fascinating. Anyway, we also know that chronic cortisol elevation affects our thyroid, affects our sex hormones, and we've talked about the progesterone steal, but it also affects fertility, libido, menstrual cycles, erectile dysfunction, and also can cause breast enlargement in men, and that's pretty much through the sex hormone binding globulin, the decrease in sex hormone binding, is it decrease, increase in sex hormone binding globulin in men that decreases progesterone and then increases the estrogen progesterone ratio. Most people don't come in with stress as their major issue. And they'll come in with a bunch of other things. They'll come in with headaches. They'll come in with autoimmune issues. They'll come in with sleep issues. They come in with anything. And as part of our intake, it's really important to evaluate their levels of stress. And if they tell you, even if they say they're not stressed, it's really good to dig a little bit deeper, because there are a lot of people who don't think they're stressed who are really stressed, or who don't think they have stress in their life, but they are in a horrible living situation, in a horrible marriage, and being home doesn't feel safe for them. And a lot of folks don't connect that much with the stress that they have, and they're suppressing their emotions a lot. Even when somebody says that they don't have stress, it's real important to know what the deal is in their lives, what they're going through at work, what they're going through at home. Are they sleeping? Do they ruminate? Do they consider themselves to be a type A person? I've had so many type A people tell me that they're not stressed. I'm not stressed. I have it all together. It's all good. And then when you measure their cortisol levels, wow. There are lab tests that we think about when we want to evaluate the role of stress. And the big one is the adrenal stress index. And I've talked about this several times. I'm going to review it really quickly. I used it in my practice as a screening tool. because there really is no better way to see how this person's body is balancing as far as their adrenals go, and as far as their stress levels go. And it often provided some really beautiful data about whether this person is really sleeping, or whether stress is in fact playing a big role. And of course, we know that the adrenals, I've shown you that triangle before, where the adrenals and the sex hormones and thyroid are all interrelated, and everything affects everything else. As I said, the GI system is very affected by stress, and it can cause stress on the system if it is imbalanced. And differences in the microbiome can affect emotion, can affect whether somebody's feeling depressed or anxious, can affect the balance between the sympathetic and parasympathetic system, cognitive function, all of those kinds of things. And of course, leaky gut then affects the immune system, which then affects everything else again. So we want to really be cognizant of what's happening in the gut. Somebody came up to me at the conference the other day and just said, so what is functional medicine? You just believe that everything comes from the gut, right? And it was very interesting, because I don't think that I would ever explain it like that. But the way I would explain it is that, and we've talked about this before as well, is that whenever I'm evaluating somebody, or I am trying to help somebody get to the roots of their health issues, it's not necessarily that the gut is the number one thing that is always causing the problem. But what I do know is that they are not being fully evaluated or fully helped unless we are paying attention to what's going on in that gut. Also, micronutrients, anything that's going to support the adrenal glands, the B vitamins, really checking MTHFR status, and vitamin B12 and folate, vitamin D and zinc, selenium. And I just wanted to, this one's a little blurry, but I just wanted to talk a little bit about the adrenal stress index. And I'm most familiar with Diagnostics, but there are a bunch of different companies that do adrenal stress indexes. And I think they're all, any saliva test will do. There are a lot of, not anyone, but there are a lot of good companies out there. And I just wanted to show you this, even though it's fuzzy, because this is just a sample first page report that gives you the data points for the 4 saliva samples. And then of course it graphs them, but this is a better picture of that. So again, this is the normal cortisol curve, highest in the morning, lowest in the evening. And these are the 4 points at which this person gave this sample. So when we look at the cortisol curves, and we've been through this before, so I'm going to go rather quickly through this little part. It's just important to know when the person, so there are three different ways the results can be read. So this is a normal curve. This first one that I showed, a normal curve. Everything's within normal limits. This would be what's called an adaptive curve. And that is where some things are within normal limits, other things are off. And so this is danger, warning, time to be paying attention. And because the adrenals are no longer able to respond in the first thing in the morning, but then they do respond as time goes on. Maybe that's because the person's got 3 cups of coffee, 4 cups of coffee on board, who knows? But then cortisol does respond, and then it drops again. And anyway, so this is one type of an adaptive response. I've seen other adaptive responses where the cortisol is quite high first thing in the morning and then drops very low very quickly. I've seen other ones where the cortisol is generally low and then comes up at night. And so each one just tells us something a little bit different. This is just one more cortisol fluctuation. Again, they don't mount a great response first thing in the morning, probably something. It's the adrenals are responding to something by noon, and then they just get pooped out. And then who knows what's happening here. That could be food sensitivities, it could be caffeine, it could be stress, arguments, it could be anything. And then this is an example of it's possibly just endogenous that we're looking at, but it is also possibly exogenous. So this would be somebody who, for sure, I would want to ask them, are they using any steroid creams, any hormone creams, any hydrocortisone at night? Or do they use a troche for their HRT? These are the questions for this kind of person. And I have seen this happen in a real person. This is someone who's having a very acute stress response. So this could be post-accident or post-surgery or post-major trauma, or the person is having a really hard time in some way. And then, of course, this is adrenal fatigue. And this is what we really don't want to see. And really, I saw this way more often than I ever thought I would. But it is true that the adrenals just can get trashed. I've seen this. I saw this in how old was she? She was 28, 29 years old. Young lady. But she had all the ACEs. She had the childhood trauma. She was in an abusive relationship. She had 2 kids by the time she was like 22. Just incredible stress in her life. She was one of those stress magnets or trouble magnets where just lots of drama happening around her. And this is what she came in with. And literally, we had to put her to bed rest and we had to get social services, and she had to go on lots of support from her family and friends. And she had to make major changes in her life. She had to find someone to get her kids to school every day, and she just needed to rest. And we did this for about a year as we did other things with her, and including she was on hydrocortisone. And it took about a year till she started getting her energy back and she started being able to be out there in the world again. Then we've talked also about progesterone steal, but this is a very real part of stress. And this is a lot of us are interested in helping people through hormone replacement therapy. We're seeing people who are still cycling who are quite estrogen dominant. And I'm telling you, this is one of the top 5 things I would see in my practice, because I saw mostly women, and I would see it in cycling women and menopausal women. And it's just so common. That's why I mention it over and over again. Is in a menstruating woman, that would be something migraines or cyclical migraines, or it can show itself as endometriosis or ovarian cysts or PMS or PMDD, any of these things. And I'm sure we've all had these people. The one that I'm remembering right now is she's probably 35 years old, and she said it used to be that people couldn't be near me. I had to go hide for a week out of every month. And she said, now my periods are coming like more every 3 weeks, and I have to hide for 2 out of 3 of those weeks. And for her, there was progesterone steal going on. There was estrogen dominance. So we hit it from the side of, we need to address your stress, and also hit it with progesterone, and really got her normalized fairly quickly. And then she was able to really move through what the stress response. And when I talk about stress response, I just want to say really quickly, there are some people who don't have a lot of stress in their lives, and they will tell you, like, I really don't have any much stress in my life. I'm retired and everything's just fine. But it's actually their response to stressors. So it's not necessarily that somebody has to have a lot of external stressors in their lives. It can be how they treat themselves, how they love themselves, or whether do they hate themselves? Are they chronically agitated, irritated with themselves or with their situation? Or do they have super high expectations? And we see this a lot in people who are stoic and hide their feelings. And then they're the ones who end up having massive heart attacks and stuff, because they were calm on the outside and then just tortured on the inside. So really important to pay attention to that. So we talked about this progesterone steal. Again, it comes from pregnenolone. Instead of it going to the pathway that makes DHEA and testosterone and estrogen, pregnenolone is forced to turn into progesterone so that it can turn into cortisol. And this is a little fuzzy too, but it's a little bit of a better slide that shows a little bit more. And so all of these things come from cholesterol. And so I'm going back to the fats thing and the truth about fats. And again, this is another piece of functional medicine. Learn this. We need cholesterol. So the cardiologists are really pushing very low cholesterol levels, like below 60, definitely below 100, preferably below 60 in a lot of populations. And the thing is that when our cholesterol gets this low, which it does in people who have cancer and people who are quite chronically ill, when cholesterol gets that low, it really affects the hormone system because hormones need cholesterol to be formed. And if they don't have cholesterol, they cannot be made by the body. So we just really need to be thinking about this. And so anyway, cholesterol turns into pregnenolone. And then from there, it can become from pregnenolone, progesterone, or DHEA, and then the DHEA pathway turns it eventually into the estrogens, or can turn it into testosterone. But when we're stressed out and we need more cortisol, then we are turning it into progesterone so that it can then become cortisol. One of the other things that the adrenal stress index, at least through diagnostics, will test for is they will test DHEA, a saliva sample of DHEA, and they will also test 17-hydroxyprogesterone. And if someone is pretty low in 17-hydroxyprogesterone, that suggests that they also is suggesting a progesterone steal. Basically right here, what is you see the top EKG shows that every beat is exactly the same time-wise, timed apart, 1 second, 1 second, 1 second, 1 second. And so that is considered low heart rate variability. There's no variability in the length between the beats. And the high heart rate variability in the second EKG, that if it's variable from beat to beat. And this is a sign that the nervous system is in more of a parasympathetic mode, more of a rest and digest and heal and pay attention kind of a mode, because it's able to regulate the heartbeat by milliseconds based on what's going on in the body. So from millisecond to millisecond, it's saying, oh, the body, okay, so now we need to be a little faster. We need to be a little bit slower. And it is responsive. Whereas when we are in sympathetic overload, and it really, for those of you who do have devices that measure heart rate variability, you know how subtle it really is. It can just be just a little tip of the balance to take us into a low heart rate variability from a high heart rate variability. So when we are in parasympathetic mode, we're in rest and digest mode, better performance, better cognition, higher adaptability to all kinds of things. And so that's really where we want to stay, is in the high heart rate variability place. And I just put up a few of our favorite devices that look at heart rate variability. There are tons of them out there, but these are, I'm not sure if this is a Fitbit or not, but I think it's something like that. And then an Apple Watch and the Oura Ring, which is I'm sure there are other ones now, but it's the only one. It was the first one that came out with just a ring that you can wear. And all of these things are also attached by Bluetooth, or a ring. That's how it gives you the information, is by Bluetooth. And then HeartMath, really, 15 years ago, 20 years ago, HeartMath seemed to be one of the first companies that came out with a way to measure heart rate variability, and it was actually rather complex. And in order for us to be able to work with heart rate variability with our patients, we had to take a course through HeartMath, and we had to get certified, and it was a whole computer program. And it was much more difficult because you'd have to have a patient sitting right there to be able to monitor their heart rate variability. And it was almost, you could use it almost like a biofeedback in helping to teach people what it felt like to have a low heart rate variability versus a higher heart rate variability. HeartMath was one of the first to come out with it. They're still around, and they are still one of the leaders in heart rate variability, but there are so many other ways of doing it now that you can just buy a watch or buy a Fitbit or buy a ring and be able to have it. I know that the HeartMath people do it. It gets much more diagnostic, and it is much more complex, I think, through HeartMath than what people get from their wearable devices. But anyway, just to let you know what's out there. And then talking about the sympathetic nervous system and its effect also on the immune system and also on the brain. So again, we talk about this neuroimmune connection. But this was a nice article that I found, that feel free to look it up. And then this is another one on the neuroimmune response during stress. So basically what happens during stress, so stress very often will cause inflammation. It causes release of a lot of the pro-inflammatory cytokines, and it activates both the innate and the adaptive immune system in different ways. And this slide just goes into all of the different ways that stress can affect the immune system. But it can cause inflammation, but it also can cause immune suppression. And so it can work in both ways. So when we're addressing our stress and our autonomic health and our adrenal health, lots of things can help. And the nice thing is now we do have the heart rate variability so that people can actually get objective data on their subjective stuff. But counseling's still number one for a lot of people, and there are lots of different therapies out there, like cognitive behavioral therapy and DBT and brain spotting, and lots of different therapies that can get to where the stressors are and pinpoint them so we can resolve them, or they can be resolved. And we know that yoga, Tai Chi, other martial arts are very useful. We also sound meditation. There are lots of things that I haven't mentioned here. These are just the beginnings of a list. But meditation, can't say enough about meditation. And there have been so many studies on meditation, and just a lot of studies have been done on minimum of 20 minutes meditation once a day, or 20 minutes meditation twice a day. And that can really help enormously. And this is something that we can just talk to our patients about, or give them a handout, or I would very often just take my patients through a breathing technique. I found that grounding them on earth and doing some breathing exercises were incredibly helpful in just like getting them back in their bodies and really bringing forth the parasympathetic response. And I think we all know of the breathing. The numbers are all different. Andrew Weil was putting it out there, and everybody has been putting out different numbers as far as the breathing exercises. But in general, taking a very deep breath in, holding over a count of 4 or 5 or 6 or 7, holding it for 7 to 10, count of 7 to 10, and then out. For anywhere from 4 to 7. I've seen them all different kinds, but just taking deep breaths in, holding the breath, and then breathing out really slowly does enormous things for the vagus nerve, and to help immediately bring us into a parasympathetic mode. And exercise, can't say enough about it, but exercise is a stressor, so we have to be careful about that, and with any of this stuff, yoga can be a stressor too. But exercise certainly can be a stressor, and we've been hearing about in the olden days, people thought more aerobic is better. And now, of course, we know that for a lot of people, after a while, the aerobic exercise is just causing their cortisol to rise because they're pushing, and then they're raising their cortisol, which is raising their blood sugar, which is causing weight gain and more stress, and then it takes longer for them to recover, and it affects the adrenals. And so we do really need to be careful about exercise. I think there's no question that exercise is important, and from a functional medicine perspective, it's been settled on that 30 minutes of aerobic 5 times a week is the gold standard. And with that said, there are some people, and especially those who are coming out of being ill or out of having issues, and of course, people who are adrenally stressed, we got to be really careful and start slow and make it fun. And we just have to be really careful about it. EFT stands for Emotional Freedom Technique, and it is another word for it is tapping. If you don't know anything about it, you might want to learn about it. I found that a certain percentage of my patients, I would say probably, we introduced it to pretty much everybody because we had a very vocal EFT practitioner in town who would come and do free sessions for our people. And I would say maybe 30% really felt like it worked very well. And basically, EFT is another word for it is tapping, and it's the use of just certain tapping on certain acupressure points and using those acupressure points to be able to help your body get into a different place. And it's used a lot for stress reduction. So anyway, that's another really good thing. And then biofeedback, and there are all kinds of vibrational tools that are used that can help people to either gain more understanding of their body, the electrical system in their body, or for treatment. Nutraceuticals that we think about, of course, B vitamins, because the Bs are so important. B12, folate, B6, so important in supporting the adrenals and the immune system, the whole thing. And vitamin C, D, magnesium. You're hearing all these same things over and over again. Ashwagandha is just a beautiful herb that really helps the immune system to regulate itself. So it's used nicely if our adrenals are struggling and low, and it can also help to regulate if cortisol is a little bit high. Mushrooms, can't say enough about them. Cordyceps, reishi, lion's mane, all really good for helping to regulate the adrenals. And inositol, which is also vitamin B8. It's a carbohydrate, and that can affect levels of serotonin, I believe, through the receptors. And it has been shown to be really useful in panic and anxiety, and also in depression. And also it's got use in insulin regulation and for fertility. Phosphatidylserine also helps with a calming sympathetic nervous system. And L-theanine, same thing. I think I have another slide that shows exactly what these do. Magnolia bark and also just good fats really can help with everything, help with hormone balance, with adrenals, with stress, with the immune system and nervous system, and just can really help everything just to kind of regulate itself.